Welcome back in, everyone. The FDA has approved the first ever self-administered treatment for heart condition, making a major breakthrough in cardiac care. Joining us to break down the significance of what this means is clinical professor Dr. Narendra Singh from the Medical College of Georgia at Augusta University and Ms. Jessica Gardner. Good morning, y'all. How y'all doing today?
Very good.
We're doing good.
So, Dr. Singh, I want to start with you, sir. What training or guidance will patients need to use this self-administered therapy safely?
So this is designed to be able to be used in the any setting rather than having to go to the emergency department. It is a nasal spray each nostril. What we ask is that patients sit down when they take it, and then one spray without any priming, and you will start to potentially see benefits as early as 5 minutes. And for many of these patients with this rhythm disturbance that can be very distressing, you will start seeing relief within 30 minutes.
That's wonderful news. This question is for the both of you, but to start with you, Dr. Singh. How does this new treatment empower patients to take control of their heart health? And for you, Ms. Jessica, can you follow up with how has the treatment been with you so far since you've been taking it?
So absolutely, up until now, if you had PSVT, treatment really required you to go to the emergency department to get an EKG to make the diagnosis, and then often put an IV in to help terminate the arrhythmia. That made it very limiting for our patients. And now the power of this therapy is that it doesn't matter where you are, as long as you have it, sit down, administer the therapy, and help terminate the arrhythmia promptly.
I think for me as a patient, I'm very excited about the possibility of having a medication that is easy to use, that I can carry with me, that I can use anytime I have an SVT episode. I have not had the privilege of getting to use the medication yet, but I am very excited about talking with my provider to be able to have this for when I travel or when I'm out and about, and it may not be, the most convenient thing to have to go to the emergency room. So I think for patients, it's definitely a game changer.
Nice. Couple more questions I'm gonna get out of you guys' hair. Dr. Singh, how might this development impact the role of healthcare providers in managing heart conditions?
Well, I think it allows us more therapeutic options for our patients, and that's very gratifying. We didn't have easy treatments for our patients. There's 2 million Americans out there with PSVT, and as we have all these wearable technologies, more and more is being diagnosed. Now, just like a rescue inhaler for asthma or an EpiPen for allergies, we now have a therapy that you can keep in your pocket, and when you need it, it will work promptly to help you out of SVT.
Nice. Last question, but this question goes for both of you. Ms. Jessica, what are you looking forward to the most with this new treatment option? And Dr. Singh, sort of what's next with the process in this treatment?
So I think the thing that I look forward to most is to be able to travel and get on an airplane without fear that I'm going to have an SVT episode and not be able to get to medical help. When I do have SVT, I have a very high heart rate, I get sweaty, I feel dizzy, like I'm going to pass out. So it's very unnerving to think that that could happen in a setting where you couldn't get help. So I'm very excited about having kind of that comfort back for myself and having power put back in my hands to use the medication.
And certainly, this is American Heart Month, and so we appreciate what you're doing. The real thing that we have to do now is get the message out there that there is a new therapy that is FDA approved, backed by excellent trials, that allows patients control of a very debilitating condition by having emergency treatment available.
That's excellent news. Ms. Jessica, I'm looking forward to that treatment for you, and hopefully it works out for the best. And Dr. Singh, thank you for your time and shedding some light on this information. Your time, both of you guys' time is greatly appreciated.
Thank you.